friends, welcome back to my channel Geeta UK Diary once again, and I am here with another video. And this video was in very much demand because most of the subscribers are asking for the interview questions which are going to be asked for a theatre nurse. तो क्योंकि मैं भी थिएटर में काम करती हूँ और मुझसे जो इंटरव्यू में क्वेश्चंस पूछे थे, अगर आप थिएटर नर्स एज एनएचएस में काम करना चाहते हैं तो आपको कौन कौन से क्वेश्चंस है जो स्पेसिफिकली थिएटर से रिलेटेड पर्सपेक्टिव से पूछे जा सकते हैं, तो इस वीडियो को आखिरी तक जरूर देखिएगा। लेकिन अगर आपने मेरे चैनल को अभी तक सब्सक्राइब नहीं किया है तो प्लीज़ इसे सब्सक्राइब करिए, लाइक करिए और शेयर करिए अपने दोस्तों के साथ, ताकि उन लोगों को भी मदद मिल सके यूके में अगर वो एज अ रजिस्टर्ड नर्स आके काम करना चाहते हैं। तो लेट्स स्टार्ट द वीडियो। तो दोस्तों, जो जनरल क्वेश्चंस है, जो जनरल वो आपसे स्टार्टिंग में पूछते हैं आपको वार्म अप करने के लिए कि व्हाई डिड यू बिकम अ नर्स, और अपने बारे में बताइए, व्हाट्स योर एक्सपीरियंस। तो ये सब जो नॉर्मल क्वेश्चंस है वो तो नॉर्मल क्वेश्चंस आपसे पूछेंगे ही पूछेंगे। इसके अलावा एडिशन में आपसे क्या पूछेंगे थिएटर नर्स के लिए, वो मैं आपको एक ओवरव्यू देती हूँ और थोड़ा डेमो करके कि आपने किस तरीके से आंसर्स देना है वो मैं आपको वीडियो अभी शो करती हूँ। So now, as we are recruiting for theatre staff, so now my questions will be based on theatre practices. So my first question is, what do you mean by surgical checklist? So surgical checklist consists of 5 steps, which are briefing, sign in, time out, sign out, and debriefing. So these are the steps which one should do in order to reduce minimal chances of error during a surgery. So in this, what every team member has to communicate with each other so that they know that they are doing the right procedure on the right patient and the mark site agrees with the consent form and imaging. So this surgical checklist make sure that we have the patient's safety topmost priority. Could you please elaborate on WHO surgical safety checklist for me? So WHO surgical safety checklist consists of the 3 steps of safety checklist, which is sign in, time out, and sign out. So what happens in sign in? Once the patient is in anesthetic room, before anesthetizing the patient, the ODP and the anesthetist do a sign in with the patient. They ask the patient about their identity. They check it with their wristband as well. They ask for the allergies, and they ask the patient what procedure he or she is going to be performed, so that they know that the patient knows what procedure is going to be performed on her or him. And in that, they also show the patient their consent and they ask whether the sign has been done by him or her. And in that sign-in, they ask lots of questions regarding the allergies, regarding which site is the surgery to be done, and regarding any artificial teeth, any hearing aid, or anything, or any questions they have. So we have to make sure that before anesthetizing the patient, we have this sign-in checked by the ODP, by the anesthetist, and by the patient. And once the sign-in has been done, the patient comes to the theater, and then we do a timeout. So timeout is a period where everyone have to be silenced and listen to the questions what are asked. So one circulator will open the consent form and this timeout checklist, and then once the patient is anesthetized, the surgeon, the anesthetist, the staff nurse, the scrub nurse will be listening to the questions asked by the circulator. And in that sign out, before making the incision, once again we confirm the identity of the patient with the wristband. We confirm the procedure, which procedure is going to be done. We confirm the mark site, agree with the consent form and imaging, and then we ask various questions regarding whether cell salvage is required, or what any other thing special, anything need to be done, any specimen how to be managed, does the specimen going urgent or routine. So all these things we discuss in timeout. So timeout is the time where before incision we do a checklist. Then regarding this sign out, once the operation has been done, everything is closed, we ask for a sign out. In sign out, we ask again what procedure has been done, which site it has been done, all the swab, sharps, instrument are accounted for or not. And then after the sign out has been done, we ask regarding the specimen, how many specimen have been collected, have they been stored in proper, whether they are going urgent or routine. Like this we ask in sign out. What do you do in timeout period of surgical safety checklist? So once the sign-in has been done, the patient comes to the theater, and then before making the incision, a timeout is done, which is done by the circulatory nurse. So she or he is going to open the consent form, and there are some checklist again for the timeout procedure. So everybody must listen to the questions and ask the relevant questions which have been asked by the circulatory nurse. So in that, again, we check the identity of the patient. Someone will read the wristband and they will match the hospital number of the patient with the wristband and with the consent form, and they will ask which procedure is going to be done. So the procedure the surgeon should verbalize the procedure, and it should be matching with the consent form, and we look for the sign made by the patient and by the surgeon. Then we are going to ask some questions specifically related to the surgery, like which procedure is to be performed, does the mark site agree with the consent form, and imaging equipment are checked and sterile, and is the patient wearing any DVT precautions like TET stockings. We ask whether the cell salvage is required or not, how the specimens are going to be managed, whether antibiotics are needed for the patient or not. So all these things we do in a timeout period before the incision is made. So that is the timeout period. Now once the operation has been done, all the counts has been done, we do a sign out. Sign out means final checking. After the sign out, the patient will be going to the recovery. So we do a sign out. In that sign out, once again we ask which procedure has been done, all swab sharps instruments are accounted for, and then we ask any antibiotic needed further, any VT prophylaxis needed, how much is the blood loss, and we ask for the specimen. So how many numbers of specimens have been collected. So this is a sign out where we questions what we have done during the procedure. Suppose you are doing a sign out and the mob count, the swab count is not complete. You are missing one swab. What step would you take? So suppose we are doing a sign out and my mob count is not correct. I'm missing one swab. So I won't allow the surgeon, I won't give him the stitch to close the surgery. I will rather ask him to look into the abdomen or wherever we are doing the procedure. I'll ask the surgeon to look for the mob inside, and I'll ask my circulator as well to look for the mob in the dustbin or in the floor, and I'll make sure that I have got the mop with me. And suppose if I haven't got the mop and we are not finding it inside the patient, and we close the stitch, and then we are going to do a x-ray just to make sure that we don't have that mop inside the patient. Could you please tell me how long an autoclave sterilized instrument be stored for? So the autoclave set, which has been sterilized by the HSDU, can be kept for 96 weeks if it is kept in a dry place, the cover is not torn, and if it is been kept safely. So we can use it for 96 weeks. And sometimes it also depends on the hospital policies, like whatever the trust policy is we go with the trust policy, but generally it is 96 weeks. Suppose you have covered a sterile set and it has not been used, and you have covered it with a sterile drape. For how long this set can be used for the surgery? So suppose once a set is open and it has not been used, it is sterile, and we will cover it with a sterile drape, and then that set can be used for till 4 hours. After 4 hours, if the set has not been used, we have to discard the discardable items, and we have to wrap the set again, and we have to send it to HSDU for sterilization, even if it has not been used, because the validity for the sterility is 4 hours once it is open and it is covered with a sterile drape sheet. How do you clean your theatre? Which solution you use for the theatre cleaning? So again, for cleaning theatre, it depends on the trust policies. Generally, where I work, we clean our theatre with chlorine tablets. We put chlorine tablets, 2 tablets in 1 liter of water, and then that solution is used for cleaning the mop of the theatre. एक चीज़ जो मैं आपको बताना भूल गई, डीब्रीफिंग कब होती है? जब आपके सारे के सारे ऑपरेशन खत्म हो जाते हैं, आपकी उस दिन के लिस्ट के सारे प्रोसीजर खत्म हो चुके हैं, उसके बाद सारी की सारी टीम जैसे ब्रीफिंग करती है वैसे ही डीब्रीफिंग करती है। तो डीब्रीफिंग में हम लोग देखते हैं कि आज की जो लिस्ट है वो कहीं अगर लैक हुआ है कहीं पर, तो किस चीज़ में लैक हुआ है, कोई केस देर से हुआ हो, कहीं पेशेंट देर से आया हो, या फिर अगर हमने अच्छा किया हो, तो सारी की सारी टीम एक दूसरे को अपलॉड करती है। So friends, these are the questions which are generally asked during a theatre nurse interview, and make sure to smile, because आपकी स्माइल से बहुत फर्क पड़ता है। Even if you don't know the answer, you just keep on smiling, and if you don't know, just say them, oh sorry, I don't know about this thing. they at least they will know that you are honest, you are true, you are not giving wrong answers. तो मैं यही कहूँगी आपको कि अगर आपको क्वेश्चन नहीं आता तो बिल्कुल आप स्माइल करते रहिए, पॉजिटिव एटीट्यूड के साथ अपना इंटरव्यू दीजिए, और आई एम श्योर आपको इससे थोड़ी बहुत मदद मिली होगी। और अगर आप थिएटर के लिए ही इंटरव्यू दे रहे हैं तो मेक श्योर करिए कि WHO सर्जिकल सेफ्टी चेकलिस्ट आपकी टिप्स पे हों, आपको पता हो, क्योंकि ये चीज़ बिल्कुल भी ये लोग नहीं भूलेंगे पूछना। तो ये आपसे ज़रूर पूछेंगे इस चीज़ के बारे में, तो आपको एटलीस्ट सर्जिकल सेफ्टी चेकलिस्ट ज़रूर पता होनी चाहिए, जो कि बहुत इंपॉर्टेंट है। इसके हर एक टाइम पीरियड आपको पता होना चाहिए, साइन इन कब होता है, टाइम आउट कब होता है, साइन आउट कब होता है। अगर आपको आज की वीडियो अच्छी लगी हो तो प्लीज़ चैनल को थम्स अप दीजिएगा और वीडियो को शेयर करिएगा, और ऐसे ही मुझे सपोर्ट करते रहिएगा। तब तक के लिए बाय।